Hi, my name is Alexis Kelly. I'm a nursing student here at FSCJ, and I'm going to be demonstrating an IV primary med administration. The first thing I want to do is take my doctor's orders and compare it with MR to make sure everything's correct. The doctor has ordered Flagyl to infuse through an IV for an hour at 62.5 milligrams per milliliter. Flagyl is an antibiotic to treat infections, specifically intestinal infections. It can be given at 500 milligrams per 100 milliliters, anywhere from 30 minutes to an hour. I'd want to note the side effects, adverse reactions, contraindications, and nursing interventions along with that medication. And I also need to know the patient's allergies as well as their lab values to make sure it's okay that they can have it. I can go ahead and draw up my med. I want to perform hand hygiene first. I want to check my medication bottle, make sure it says Flagyl on it, and make sure the expiration date is still good, which it is. I can open an alcohol prep, swab the top of the vial, drop a ml of air, uncap my needle, inject the air, and then draw up a ml of the medication. And then I would recap my needle. I can go ahead and inject it into the primary bag. I'm going to wipe off the bag tube with an alcohol swab and inject my medication. And then I'm going to throw my needle in the sharps. I want to go ahead and label my bag. I want to put the patient's name, the drug, the dose, the route, the time, and my initials. I'm going to mix my medication. And I can go ahead and spike the bag. Make sure everything's clamped off. I want to go ahead and prime my tubing. So I'm going to unclamp it. Once I've done that, I can clamp it back off. I'm going to label my tubing with my initials as well as the time and date. And I can go ahead and hang my bag onto the IV pole. Okay, at this point, I have everything I need to go into the patient's room. I would knock on the door, take all of my supplies in with me as well as my doctor's orders. I would introduce myself to the patient and identify them using two forms of identity, their name and birth date, and I would check that with their armband as well. I would go ahead and explain the procedure, double check for their allergies, make sure they don't have any, and then I can go ahead and perform hand hygiene as well as put on my gloves. The first thing I want to do is check the IV site for any phlebitis or infiltration, and I'll also palpate the IV site for any kind of tenderness that they may be having. Okay, so everything looks good. Before I hook up my IV, I want to flush the IV tubing and check for patency. I have a 3 ml syringe filled with normal saline. I'm going to swab the top of the syringe as well as the IV tube. I'm going to go ahead and hook up my syringe. And I'm going to use the ASASH method, so I'm going to aspirate and look for blood return. Once I see that, I'm going to use the push-stop method. So every half a ml that I push in the normal saline, I'm going to stop. And I'm going to continue to do this until I get done. Once I've done that, I can disconnect the syringe. To the side. So I've checked for patency, I've checked for phlebitis or infiltration. I can go ahead and hook up the IV. I'm going to use my alcohol prep to wipe off both tubings again. I'm going to make sure my IV tube is clamped. I'm going to go ahead and connect the IV. At this point I can go ahead and unclamp my IV tubing. I want to count my drops per minute using my watch, which I've previously calculated to be 17. So I'm just going to watch my watch the drip chamber. Once I've done that, I'm going to let the medication run its course for over an hour. I'm going to come in periodically and check on the patient, make sure they're doing okay. I'm going to look at their IV site for any type of allergic reaction, phlebitis, or infiltration. Once the administration is over, I can come back into the room, perform hand hygiene again, put on clean gloves. I'm going to make sure it's ran out. I'm going to clamp my IV tube and clamp all of my primary tubing. I'm going to disconnect my tubing, and if it was an older IV, I'd go ahead and apply a new alligator clamp. I'm going to grab my 3 ml syringe again full of saline and again perform the ASASH method. So I'm going to wipe off the end of it with an alcohol swab, the syringe itself as well as the IV tube. Connect the syringe to the IV. Unclamp my IV tube. I'm going to aspirate, check for blood return. Once I've seen that, I can do the push stop method. For every half a mil I push, I'm going to stop. And I'm going to continue that until I finish the 3 mils. Okay, I'm going to reclamp the tubing and disconnect my syringe, throw that in the sharps, and clean up my area. I'm going to check the site again for phlebitis or infiltration. I can go ahead and I'm done at this point. I can take off my gloves, perform hand hygiene again. I'm going to go out of the room. I'm going to document the drug, the route, the dose, and the time, as well as the condition of the IV site and the intake and output.